A warm welcome. You're joining us at Hyde Park on AdaDerana 24. We'd like to talk about the COVID-19 measures, the drive, the inoculation drive that the government has embarked on and the current status. I've invited to our studios the State Minister of Primary Healthcare, Epidemics and COVID Disease Control, Dr. Sudarshini Fernandopulle. Good evening and a warm welcome.
Good evening.
Aibon. First of all, I'd like to ask you about the current status, the process, and how far we have come in the COVID control measures that have been undertaken by the government. Of course, we know by now that more than 150,000 inoculations have been completed, and we do roughly about 12,000 PCR tests. But beyond that, what can you give us as an update?
I think the main strategy to control COVID now has been identified as immunization. You know, world over, countries are inoculating their population, giving priority to the elderly. So likewise, Sri Lanka also launched the immunization program. Of course, the Ministry of Health had planned to commence it by mid-February, but we were lucky. Thanks to the commitment, the dedication and the political leadership shown by His Excellency, we were able to get a donation from India. And right now, I must thank the Indian government for their generosity. We received 500,000 Oxford AstraZeneca Covishield vaccine. And with that, we were able to launch the vaccination program 2 weeks ahead of schedule. And right now we have overcome the 150,000. So, we have vaccinations have surpassed the 150,000. You know, the numbers have are more than 150,000. And of course, very few major side effects have been reported. Like hardly any, none of them had to be sort of admitted to ICU. But of course, with any vaccination, you tend to get fever, body aches and pains, because this is a program where the older people are getting, adults are being vaccinated. Whereas in the past, we have very successful immunization programs focusing the children, and these very young children, they get vaccinated, but of course they too have fever, malaise, pain at the site of injections, but hardly complain because they are less than 1 year, they don't know, of course, so therefore these are mild symptoms which you can get with any vaccination. So right now we don't have any major sort of adverse effects following vaccination, and we are planning to initiate vaccinating the general population, say by early March. Yes. So right now we are anticipating vaccines through the COVAX facility. That is approximately to cover 4.2 million population. And we also have placed an order with the Serum Institute to procure 18 million doses, that is targeting 9 million population. So our aim is to cover 60% of the population.
Right. There is talk that we want to be the first country that will fully vaccinate, inoculate the entire nation. So what is the, there's probably a stringent mechanism here on the step-by-step methodology. We're looking at a target group and we're looking at over 30 and then above 18 years. So what is the progress here?
Of course, the vaccine is not recommended for pregnant and lactating mothers and also for children less than 18 years. So this population is approximately 35%. So we have a balance of 65%. So we have already we have vaccines for 250,000 population, and we have been promised another donation by China. So we are in the process of planning the vaccination program. So through COVAX facility also we have been told that we will get the first stock by end of February or beginning of March, and here the priority will be given to those above 60 years of age. But globally, the deaths have been taking place in the elderly population. Looking at our statistics, we have found that of the majority of the COVID positive patients, only 10% of elderly people have been identified, but the majority are between the ages of 30 to 60. So the Ministry of Health has decided to concurrently, while giving priority to those 60 and above, to start vaccinating the 30 to 60 population concurrently. So that is why it was estimated that we may need an additional 18 million doses, and we have placed the order with Serum Institute of India.
The government obviously faces challenges too in procuring these vaccinations and also in finding funding. What is the process here?
Of course, Indeewari, funding is not an issue, because right now we do about 15,000 PCRs per day, and each PCR costs around 6,000 rupees. So we are spending about 90 million per day on PCRs alone. So for a month it comes to about 2.7 billion. But when we cost the vaccines, like to purchase 18 million doses, each dose costs $3. And only for vaccines we have estimated approximately 54 million US dollars, which comes to around 10 billion rupees. This is and we also have the infrastructure in place, because we have been vaccinating for a long time. We have had a very successful immunization campaigns, especially for children. So infrastructure, we don't have to spend heavily on improving infrastructure, but for vaccine, it's around 10 billion. That's nothing, because we spend more on providing fertilizer subsidy, on providing some of the subsidy, for so many things. So 10 billion is an investment for the country, through which we can initiate all other activities, especially, we can regain our lost economy. So I think it's an investment. So funds is not a problem. Government has given priority to procure vaccines.
There has been a request from the private sector also to be a part of this inoculation drive. Does the government, will the government look at this positively?
No, of course, the private sector pledged support to procure vaccines, because they want their the human resources to be protected against COVID, so that they can contribute and start the economic drive. So the government has principally agreed. They will provide funds to procure vaccine, and government will give priority to vaccinating the young population, that's 30 to 60, because with that I think we can get back to our economic activities, especially our the free trade zones. The export economy has suffered immensely because the second wave was initiated in the garment trade, and as a result they have incurred heavy losses. So I think this is an investment for the future.
A medical professional for 24 years, I think you'd be able to give us more understanding of this. There's talk about the efficacy of these vaccines, from the Oxford to Pfizer to Russia's vaccine. But we have been using the Oxford vaccine from the UK, and there's also talk for Russia supporting Sri Lanka's production of their vaccination. What kind of an understanding would you share with us and our viewers?
Of course, Oxford AstraZeneca was reviewed by the National Medical Regulatory Authority of Sri Lanka, and they have given approval for emergency use, and WHO also is in the final phase of giving listing for emergency use, and most of the countries like UK, the European Union have given emergency approval, and the efficacy with the first dose was estimated to be around 60%. But this the scientific evidence keep on changing, right? Now it has been found that with the first dose, even at 3 months, about 76% of the population have antibody levels, which I think is very positive. And also again, science, there's evidence to show that the transmission has been reduced by 67% after 1 dose. So initially the recommendation was to give 2 doses at 4 weeks intervals, but now the recommendation is to postpone the second dose, because with later you know, when there's a like, you know, when you give the second dose later on, like say around 12 weeks, the response is much better.
Right.
So the information keeps on changing. But the Pfizer has an efficacy rate of around 95%. But we have an issue with Pfizer because it has to be stored at -70. So we have limited supply, you know, facilities to store Pfizer. So even if we get Pfizer through the COVAX facility, we are ready to accept. You know, and transport at -70 and give vaccinate. So again, Moderna, but Pfizer vaccine is expensive. Whereas Oxford AstraZeneca has very few side effects. The dose, one dose costs around $3, whereas Pfizer is around 20, and Moderna is even more expensive. It's around $40. Again, the efficacy is around 94–95%. Sputnik vaccine also, they say it's 100%, but I have not seen any, you know, I have not gone through any scientific evidence, but it is, you know, the efficacy is anyway more than 90%. They have submitted documents to the Sri Lankan NMRA. They are reviewing. They are in the process of reviewing. WHO has not still, you know, like the Oxford AstraZeneca, they are, I think, in the first stage of reviewing the vaccine. But to manufacture Sputnik, it will take some time because we
Are we considering it at the moment?
Of course, yeah, there have been, you know, discussions with Honorable Channa Jayasumana, that ministry and the Russian embassy. They are having discussion. So to manufacture, it will take some time because we need the infrastructure. So, but it will be a long-term process. But for the present, I mean, at present, to, you know, to control COVID, we will have to procure and vaccinate our population. And as you said, we are looking at zero transmission. So, say within the next 2 to 3 months, we should be able to reduce transmission.
Immunization is nothing new for Sri Lanka. We've had a very effective system, and since you're born, any child is vaccinated, and then it goes on. But how is the response so far from the general public? We are aware that you start the vaccination process from the emergency healthcare workers to those in the front line. But what is the response to the government?
Of course, the response has been very good because we daily we get, you know, calls from different sectors asking them to be included in the priority list. So right now we are taking stock of the existing, you know, vaccines because the private sector frontline health workers, they are requesting, you know, to be included in the first, you know, the priority group. Then the different, you know, other, like, you know, the electricity board, the water resources board, you know, there are different sectors. I think the airport, of course, received priority. So there are different sectors, like, you know, the medical students, the university students. So we have a very good, you know, demand from the population. The response is good. People are awaiting, you know, the initiation of vaccination of the general population. So the response is good because we have had very successful immunization campaigns. That is because our literacy rate is high. It's especially the female literacy. You know, so the demand for services is, you know, we see a demand, and our coverage has been, you know, around 99% throughout. And we have a very good system to monitor the adverse events following vaccination. So the people have confidence in our health system and our vaccination program. And childhood vaccination, the majority of the population depend on the government sector. So only very few, a small percentage who get the services from the private sector. So I think overall we have a very good, you know, we have a very good response from the people.
As a government medical specialist, as an officer from the past, obviously these vaccinations, as you get the jab, there are certain side effects. So I'm not sure about the medical term here, but there may be concerns of what kind of side effects or what kind of consequences you face. How would you respond to these concerns?
Of course, the epidemiology unit has given very clear guidelines. So if they have severe allergies or if they have had you know, adverse effects following any vaccination, I mean, they will not be given. But of course, you are getting a foreign body into your body. So the system tends to reject it. I mean, whenever we get a viral infection or bacterial infection, the system tries to fight with and fever is a, as a result of this ongoing fight between our systems. So fever, body aches and pains, pain at the site of the injection, these are common side effects. So it shows that the body is responding to whatever has been given to the body. So this is the response, the response that the body gives to any foreign body. So by about the 10th or 14th day, antibodies will start appearing, and with the second jab, the response will be even quicker.
Right. Yeah. We're also talking about vaccinations and PCR tests. We know that about 12,000 to 15,000 PCR tests daily are carried out across the island. Is there a way that the government is looking at increasing this or improving this on a daily basis? Is there a necessity to do this?
Of course, at present there's a necessity because the cases are, there has been a slight increase in the cases. So the government sector has a capacity of around 15,000 supported by the private sector. But right now some labs are not functioning optimally because I was told some, the staff members have been quarantined, and these have been operating over the past 1 year. So these are machines, we need reagents, we need human resources. So and also the routine investigations have been at standstill, because priority has been given to PCR testing, the other viral testing. So now the MRI, the Jayawardenepura University, they have recommenced the other routine investigations, and as a result the numbers have gone down. And again at Bandaranaike International Airport lab, they were doing a wonderful service, but I was told that about 6 staff members have been quarantined, so the numbers have gone down. But right now we will be maintaining the existing services, but with vaccination I don't think we have to expand it. With vaccination we are pretty sure that we will be able to reduce transmission and reduce the incidence of.
When do you expect to achieve this inoculation target?
But if we have the vaccines, I think we can start by early March, first week of March, because we are planning to establish 4,000 centers. On each day, on a single day, 2,000 centers will function, and each center will cover about 300 people. So 300 vaccinations into 2,000 centers, around 600,000 per day. So within, say, 2-3 months, we can cover the 60-65% balanced population. So it's not an issue because we have had national polio immunization days, even when the civil war was ongoing. Even the war was stopped temporarily to inoculate the children. So even the terrorist groups prior to vaccination, so we have a very trained personnel. We have trained personnel. We have the infrastructure. We are capable of handling it.
I think it's time we take a short commercial break here at Hyde Park. To stay with us, we'll return with more questions. We're in conversation with Dr. Sudarshini Fernandopulle, the State Minister of Primary Healthcare, Epidemics and COVID disease control. Welcome back. Dr. Sudarshini Fernandopulle, the State Minister of Primary Healthcare, Epidemics and COVID Disease Control, is answering our questions on the government's vaccination drive. We spoke about the response of the general public and healthcare workers to this vaccination, their interest. But if there are parties that want to opt out of this, is that also a possibility?
Of course, this cannot be given forcibly. We have a consent form. We have to inoculate with the consent of the people. So even if we do any interventions like surgeries, we get the consent of the people, so the patient. So this will be given, this will not be forced on because but we have achieved, when looking at the childhood immunization program, it has been voluntary. We have achieved 99% because the people, the Sri Lankans, they supported, they were health conscious and they were literate about the need to get immunized. So likewise, I think the people will, it won't be an issue because our health literacy is quite high. So people will support the launch and the vaccination program.
We're also talking about the social responsibility one has in pandemics as this and the requirement to adhere to government healthcare guidelines and social responsibility etiquette. How does the government view the public response so far?
Overall, the public support has been good, but on and off we see some people acting irresponsibly. It's important to get the support of the entire population, because it's a disease which is transmitted through droplets. So you have to wear the mask at all times, covering both nose and mouth. Not only the mouth, the nose and mouth have to be covered. You have to maintain distance, and also respiratory etiquette, like using a tissue while sneezing, coughing, or your elbow, and also keeping your hands clean is very important. Even with the vaccination, you have to maintain the distance, wear a mask at all time, because it prevents diseases but not infections. Because even though you may not get the disease, but you can transmit the infection to another person.
You said yesterday that the virus spread has reduced by 65% by the present administered vaccine.
That's with the Oxford AstraZeneca. They have found that with the first dose, the transmission has been reduced by 67%.
Right. I also want to ask you about the strain of the virus from the UK. We did talk about one case that had travelled from the UK. But what is the status of this strain that we're talking about and people are so concerned about?
Because COVID, this virus is such, it keeps on mutating, it keeps on changing. But with this UK strain, we had detected one, but that's not an issue, because this particular person is quarantined for 14 days. So once he is released to the society, there's no risk to the society. So there's no risk, but it's important to continue surveillance, to monitor the viruses, the mutations, because some mutations may be virulent, it may be more infectious. But whatever said and done, the available information, scientific information is such that the present vaccines are effective even against this new strain identified in UK.
At present, there are also cases in excess of 700 being reported on a daily basis. Not all of them are linked to a cluster, but the GMOA has been warning about a community transfer, which the government says no, denies. What is the status so far?
Community transmission is a technical term used by the WHO, used by the health authorities, because the strategies you use to stop transmission is different when it is cluster spread than community spread. But of course, lay people, of course, they think it is in the infection is in the community. So why not? It's a community spread, but this is a technical term. Still, we see clusters of cases linked to the original case. So like at present, our strategies would be early detection, isolation of the positive patient, quarantine the first contacts, hospitalize the positive patients, and those with comorbidities to be sent to special hospitals for designated for COVID patients.
Right. You said community transmission is technical term. So does this mean we're not talking about mass infection of
no, because the other evidence we have that we don't have community spread is only 10% of our elderly population have been affected so far. If it was community spread, our death rates would skyrocket, and the numbers of elderly patients would be very high. So right now, of the infected, only 10% are above 60 years. So it is again supports that we don't have community spread.
Right. I think it's time we take a short commercial break here at Hyde Park. Welcome back. We're in conversation with State Minister Dr. Sudarshini Fernandopulle. As we discuss about the world over how vaccination and that inoculation drive is undertaken, we also hear of excessive demand by countries, where some countries stock in excess of doses. And recently we also heard about the European Union export controls, which were heavily criticized by the WHO as they announced of export controls on vaccines produced within the bloc, where these vaccines had to be sold within the bloc before they were sold outside. But in case there is a shortage for the government to achieve our vaccine targets to inoculate the entire population, what will be the contingency plan?
Of course, as you mentioned, there's a huge demand for the vaccine. Certain countries have purchased and stocked numbers much more than their population. So that is why the WHO has formed this COVAX facility to ensure equitable distribution of vaccines to the low and middle income countries. So through this, all countries will get 20% of the stocks. But we have requested vaccines from Serum Institute. The Oxford AstraZeneca is manufactured in 8 countries, and Serum Institute is one. And we have been purchasing vaccine from Serum Institute. So I am pretty sure that we will be able to get our stocks from the Serum Institute. But again, we are also looking at Russian. We are in the process of getting approval for the Sputnik, and again the Chinese Sinopharm, because Sinopharm also has been used in Middle Eastern countries quite effectively. So we are looking at different vaccines. Again, Pfizer, we have already identified the infrastructure facilities, to a limited extent. So we are looking at a mix, depending on the availability. But still, I think we'll be able to get our stocks from Serum Institute, because we have been dealing with them for a long time.
This is the Chinese.
No, the Oxford AstraZeneca Covishield, because it's already approved, already used in our society. Already people are confident about this vaccine. Very few side effects, so very confident that we'll be able to purchase from the Serum Institute of India. If there are any shortfalls, we'll look into other countries, other avenues, etc. So it's not an issue.
Right. I think it's also documented about China going to give Sri Lanka 300,000 doses, which covers about 150,000 people. Yes. Is there any talk to increase this donation?
Of course, we can have discussions with them. But now, right now, we are in the process of registering it. NMR is going through the dossiers. To first it has to be registered. It has to get emergency approval. After which we can, accept the donations and start. So we would prefer to have one type of vaccine, because the people are confident, they know what they are getting. When there's a mix, there might be, issues. But we are pretty confident that we will get Oxford AstraZeneca, because through the COVAX facility also we have been assured that we will be getting the Oxford AstraZeneca. So there are other, so we are very positive that Serum Institute will comply with our order. So it will be, we will not need the entire 18 million, at one go. They can deliver it in blocks of say 3 million doses, over a period of 2 to 3 months. So I don't think it's a major issue, because right now in England they are only giving the first dose, because they say you can repeat it after 12 weeks, because the current evidence says that with the first dose the antibodies are sustained even at 76% have antibodies even at 3 months. So we are also looking at the new literature, the science, the evidence to see whether we have to repeat it, give the second dose at 4 weeks or maybe later on, or later on. So it depends on the available literature. It keeps on changing. Whatever we say today may not be, tomorrow it may change, because that's science. Science keeps on evolving, and corona evidence, scientific information about the corona vaccine keeps on changing daily, because there's so much of research. So, we are very positive that we will be able to get, vaccines to inoculate our population.
Does this mean if the second jab is delayed, that these doses will also be used to vaccinate further?
If so, we will need only say for 132, we will need only half of it, and we can prolong, the second dose to up to 12 weeks. But it's again, we have not decided still,
right.
Yet to be decided. But right now, the second dose will be repeated after 4 weeks.
There's also talk that the government has taken too long to receive the WHO's COVAX facility compared to other countries like Palestine.
No, I don't think the COVAX facility has started distributing, because we complied with their request. We sent in, we met all the deadlines, the request, this document, the National Deployment and Vaccination Plan, whatever they requested, we have kept to, the deadline. So we have requested, so we have been told that we'll get it by, say, first week of March. So I think, and they will also have to phase out their distribution, because they have to distribute vaccines to most of the, especially the low and middle income countries. So we will keep on getting until, say, about May, June, the 8.4 million doses through the COVAX facility. So we have complied with their deadline. So there's no issue, and they are WHO is pretty confident that we will have a very effective immunization campaigns, because we have in history, we have proved that we are a country capable of vaccinating our children. So I think they have confidence in us, and they will comply with our requests.
We have a priority group of 30 to 60. Will this also cover the prisons?
Of course, yes. When you say the priority would be to 60 and above, but at the same time, parallel to that, we will start vaccinating the 30 to 60 years. So it will cover the entire segment of population,
While we talk about COVID, there's also dengue and other diseases that have not been given too much attention in the media. But in terms of the healthcare system, what kind of attention do we have? Because dengue was a massive concern for us before COVID.
But even now, it is an issue, but it's being controlled. But right now, because of this pandemic, priority has been given to the corona patients. And again, people, there are, people are not getting the routine services. The routine surgeries are not taking place properly because of this COVID threat. So, but with vaccination, I think, within the next 2 to 3 months, everything will get back to normal. That's why we are investing heavily on vaccination, because with that, we will be able to control. I mean, that is the main strategy used by most of the countries, and which is also recommended by WHO to prevent COVID infection. So I will request our Sri Lankans, as they have supported our immunization campaigns where they have brought their children, they had confidence in our system. I request the public to support the vaccination drive, which is initiated by the government, so that we will be able to eliminate corona from Sri Lanka during this year.
On that note, it's time we wrap up. Thank you very much for your time here at Hyde Park.
It's a pleasure.
We had with us the State Minister of Primary Healthcare, Epidemics and COVID Disease Control, Dr. Sudarshini Fernandopulle, joining us at Hyde Park on AdaDerana 24. Thank you for joining us. Have a pleasant day.